But obviously with frequency, obviously the question always comes intensity. And is there kind of any maybe optimal intensities that you've seen from studies, or anything you would say about intensity for people trying to treat arthritis?
So intensity, like I mentioned this earlier, it's quite an important factor for me, especially for things like arthritis, which is a real chronic condition that people have had for many years. And it tends to be in the center of a joint. So it's not an easy area to get to. It's deep within the body. And I would say that intensity, most PEMF devices, you're going to get a result for arthritis over time. But if you want to get a result quicker, then we would recommend looking for something in the medium to high intensity range. This is going to have a better penetration into the body, and you're going to get results from those systems a lot quicker. So we're putting a number to this, going for treatment of arthritis, you're looking at a full body mat from 30 to 50 Gauss and above. So that's kind of in the medium to higher intensity range. You don't necessarily have to go into the thousands of Gauss. So I know Dr. Paulick's written a book, and his book, he's very, very pro high intensity, and he nominates specific intensities for certain things. And arthritis, he nominates a very, very high intensity. From looking at the customers that we've had over the years, over 10 years of selling PEMF devices, what we tend to get that people, even with a 1 Gauss system, will get results, but it will take a very long time. So we're talking about a year, 2 years before they start noticing a difference in the pain and reduced inflammation, all that sort of thing. With those people, a lot of the time they plateau. So they get to a point where they've gone from a pain level 8 and they've brought it down to pain level 5, within the first couple of months, and they're like, right, this is great. But then they kind of get a bit of a plateau, and they don't seem to be getting the further results. That could be down to the fact that they're using the same frequency. Their body's got a bit more accustomed to it. But a lot of the time, what we tend to do with these people is we up the intensity. They get the device that maybe offers 50 Gauss or above, 100 Gauss, 1,000 Gauss, that sort of thing. Within the next month, they start noticing that those benefits will start to creep in again. So their pain score goes from 5, starts reducing down to 3 and 2. And as the body starts to build that cartilage again, they start to be getting much more quality of life and the benefits from the PEMF therapy.